Thank you and good afternoon. So for today, we don't have all of the numbers in yet, but the overall totals are in. So we do have 874 new people who've been diagnosed with COVID-19 in British Columbia, bringing our total to 128,763 people who've been diagnosed with COVID-19. That includes 187 people in the Vancouver Coastal Health Region, 574 people in the Fraser Health Region, 29 people who live in Vancouver Island Health, 60 people in Interior Health, and 24 people in the Northern Health Region. We don't have the active cases and some of the people under public health monitoring at the moment, but those will be updated on the BC CDC dashboard later this afternoon. Of the cases that we have in BC, 503 people are in hospital right now with COVID-19, 178 of whom are in critical care or ICU. We have 7 active outbreaks in long-term care, assisted living or independent living, and 6 in acute care. We've had an additional 1 death, one person who's died from COVID-19 in the last 24 hours in the Interior Health Region, bringing the total number of people in British Columbia who've died from COVID-19 to 1,577. Our condolences go again to all of the people who have lost loved ones, to their family members, to their care providers. Our thoughts are with you during these difficult times. To date, we've delivered 1,749,375 doses of all 3 of the COVID-19 vaccines in British Columbia. Of those, 90,296 are second doses. Starting next week as well, we expect to receive the Johnson & Johnson or Janssen vaccine, which is a single-dose viral vector vaccine. And as I've mentioned, we'll be integrating this into our immunization program. And currently, we are finalizing the plans for that, and we'll share that information with you early next week. In the meantime, we are continuing with the mainstay of our program here in British Columbia, which is the age-based, risk-based program. And that includes going down in increments by age, because we know that even the age difference between 40 and 50 increases your risk of having more severe illness or hospitalization with COVID-19. And we're seeing that, unfortunately, in some of our communities in British Columbia. In addition, we've identified over 200,000 people who have conditions that put them at a risk that's commensurate with an age that is higher than theirs. And that's our clinically extremely vulnerable program. And that, again, has identified over, I believe it's 70% of people who received a letter have now received their vaccine. And we are booking people who are 58 and above across the province. It's important to know as well that we have had our priority worker program that was a little bit waylaid because of the concerns and the issues we had with the AstraZeneca program, but that has continued, particularly for first responders, for school staff, and for childcare staff. And it's about 15% of the overall vaccine that we've had in the last few weeks. And as you know, the amount of vaccine that we've had in the last few weeks has been constrained, which has meant that we've been able to do that by high-risk communities, and it's been prioritized around the province. Right now, registration is the most efficient way to get registered and to get your vaccine in our programs, the age-based program and the worker program. Registration makes the process seamless. When you're in the system, you will be notified. It's the most efficient way of getting notified when your age or risk category or worker category comes up. And you will be guaranteed your vaccine in that clinic that you have been booked into. And that's how we are monitoring and making sure that vaccine goes to those clinics where people are registered and where the vaccine is designated for them. And even though they may not seem busy at some times, that's because we have a lot of capacity to be able to deliver vaccines through those programs, through those clinics around the province. You will be notified and a vaccine will be reserved for you. And this program is the Pfizer and Moderna vaccines, primarily the Pfizer vaccines. And it has been slow, but the good news is that we will be receiving much more vaccine in the coming weeks, and this process will again be able to be sped up. In the next month, we expect to receive over 1 million doses of the Pfizer vaccine. And that means that our age-based program will be accelerated, and everybody will get their turn. In addition, our worker program will be able to be accelerated as well, because 15% means a much higher volume of vaccine that we'll be able to provide people in the coming weeks. So this is the good news, and this is what we have to look forward to in the coming weeks, where everybody will have access to vaccines, and every adult in British Columbia will have access to vaccines by the middle of June at the rate that we expect to go starting next week. As you know, in addition, we've been trying to reach certain populations that have not registered. And those populations, we have been doing targeted clinics in certain areas, doing outreach clinics, and as we saw this week in Fraser Health, trying some new and innovative ways to try and reach people through pop-up clinics or drop-in clinics. And we admit there have been challenges with those clinics, and those have been concerning in how we operationalize it. The good news is that thousands of people got doses of vaccine. But right now we need to regroup and determine how to best and most efficiently provide that vaccine to people in every community, but particularly in those communities where we know transmission rates are very high. And we'll be working with Fraser Health and with Vancouver Coastal and with our counterparts across the province to see how we can do that best in the coming weeks as more vaccine becomes available to all of us. As we know as well, people spread COVID-19. We spread it to each other, to the people that we're closest to, and we also spread it when we travel, even small distances. With the travel orders in place, we are all required to stay within one of our 3 provincial zones, unless it is for essential travel. And there is very good and valid reasons why many of us may have to travel, whether it's for work, whether it's for medical care, to receive a vaccine, or to support a family member in a crisis. If you are unsure, however, whether your travel would be considered essential, then you should be staying put right now. Stay within your community. While we know transmission is everywhere, we are seeing the greatest level of transmission in communities in the Lower Mainland right now. So for people in the Fraser and Vancouver coastal health regions, I'm asking you to pay particular attention. Our hospitals in these regions are feeling the strain more than ever. And hospitals in smaller communities don't have the capacity to carry any additional burden right now. Communities, especially smaller communities with limited healthcare services, are asking for your support by staying away for now while the provincial travel orders are in place. This means for people who live in the Lower Mainland zone and may have a second home or be planning to an escape to the Sunshine Coast or Sea to Sky corridor, I am asking you to stay away right now on behalf of those communities. Leaders in these communities are telling us they are not ready for an influx of additional people in the coming weeks. So between now and the end of the May long weekend, let's give those communities, some of whom, like Whistler and Squamish, have had tremendous challenges with this virus in the last few weeks. We need to give them a break by staying away right now. And we all need to continue to pay attention. Our cases are still much higher than we want them to be, and that tells us that transmission is still happening in our communities. And if I just reported, the number of people in hospital is at the highest levels that we have seen in these past few days, and people requiring specialized acute critical care is the highest ever. We're using every last drop of vaccine, and we'll continue to do whatever we need to break the chains of transmission. But we need your help. We are in a tug of war with COVID-19, and I know most people are doing their very best, and for that we are very grateful. But when you get tired or frustrated or angry, as I know many people are right now, things can slip. We need to dig in our heels and use our collective effort and momentum to pull back. We can continue to be angry at this virus that has led to so much disruption and pain, but we need to hold steady in our efforts. We need to hold the line. Take the simple steps of sticking with our layers of protection, staying small, staying local, and following all of the orders in place. And get the vaccine when your turn comes up, as it will in the next few weeks. Your efforts, your kindness, your resilience, this was what will make us win at the end of the day. We are closer each day, and as this month of May is coming upon us, we will get there. We will get there, and we can do it by supporting each other, by remembering to be kind, to stay calm, even when it's challenging and frustrating, and to stay safe. Thank you.
Thank you very much, Dr. Henry. I wanted to start by offering my condolences to the families, the friends, the caregivers of the one person who's passed away in the last 24 hours from COVID-19 in British Columbia. That person was in the Interior Health Authority. It's a fundamentally difficult time to grieve the ones that one's lost, and we are with that family and those communities today. As Dr. Henry has said, there are 503 patients in hospital right now with COVID-19, and that presents significant challenges for healthcare workers, challenges, as you know, and I'll be reporting on surgeries shortly, that have been mitigated somewhat by the reduction of non-COVID patients in hospitals, so that the overall hospital numbers are stable, but obviously the impact of increasing COVID-19 numbers, particularly in critical care, is felt. I want to talk briefly about vaccines, and Dr. Henry has talked about that, the vaccines that have been received. We've now received all 138,060 doses. The remainder that we're receiving this week of Pfizer vaccine, that it arrived, the final vaccine arrived yesterday. So that means that to date, as of the end of day yesterday, we've received 1,302,990 doses of Pfizer vaccine, and we've administered 1,189,756 of those doses. Obviously, we won't receive doses now until the beginning of next week when we receive more, 276,000. And so we'll be working our way through the remainder in the coming days. With respect to Moderna, we've received from the beginning of the pandemic to the present 354,800 doses, of which 328,281 have been administered. We're expecting to receive tomorrow or over the weekend 82,300 more doses. And with respect to AstraZeneca, where our reporting is a couple of days behind, because a lot of that has been delivered through the pharmacy system, we've received 314,700 doses and administered 231,338 doses of vaccine. I wanted to note that our clinically vulnerable effort, and from March 29th onward, people who are clinically extremely vulnerable have been able to register and book appointments. And to date, and you'll recall initially, we looked at that as about 150,000 people. In fact, 188,801 clinically extremely vulnerable people have already been vaccinated in BC, in every community around BC. And that includes a further 10,247 who currently have appointments booked. This is a significant achievement of our healthcare system, and we're very appreciative of the team led by Dr. Maureen O'Donnell at the Provincial Health Services Authority that has led this effort. I wanted to also say finally with respect to vaccine that if you have not registered for vaccine, and yesterday all those 58 and above, people born 1963 and before, are able to book appointments. But the system is to register either on the phone or online, and then as soon as you are eligible to book, you will be contacted and be able to book your appointment. And with more vaccine, 276,000 doses of Pfizer coming in next week, we will be moving down the age cohort. So if you have not registered and you are of any age in BC, above 18 and above, this is the time to register so that you can be in a position to book. Everyone in the coming 2 months will have the opportunity to have their immunization, their vaccine, their vaccination, and we want everyone to be ready to register. So register, register, register. This week's update on surgery continues from news that we provided last Thursday. 9 hospitals across the Lower Mainland were moving to performing only urgent and emergent surgeries. The decision to postpone non-urgent scheduled surgeries was made to ensure these hospitals had the critical care available to care for patients. This Lower Mainland action in the Vancouver Coastal and Fraser Health Authority remains in place. We recently reported that some postponements had occurred in Island Health to support staffing and capacity there, and this week the effort to support staffing and capacity continues. This has resulted in some postponements in Island Health as well. Island Health is performing urgent and emergent surgeries and focusing on delivering non-urgent surgeries that allow patients to go home the same day. I just, so with respect to the shift that began April 26th, that change in the way that we deliver surgeries and the postponement of non-urgent scheduled surgeries in Fraser and Vancouver Coastal Health, but a number of postponements were made prior to that as health authorities readied themselves. Today we can report the number of surgeries postponed from April 19th to April 25th was 398. It's 198 in Fraser Health, 197 in Vancouver Coastal Health, and 12 in Vancouver Island Health. It's important to note that no surgeries were postponed in Interior Health, Northern Health, or the Provincial Health Services Authority. Just want to report that for the week April 12th to April 18th, this is the week before last, health authorities completed 7,045 surgeries in total, of which 5,532 were scheduled surgeries and 1,513 were unscheduled surgeries. By health authority, that's 1,799 in Fraser Health, 1,285 in Interior Health, 418 in Northern Health, 1,735 in Vancouver Coastal Health, 1,488 in Vancouver Island Health, and 320 in the Provincial Health Services Authority. As this report and last week's report have made clear, this is a particularly challenging time in our COVID-19 fight, with pressures on healthcare staff and hospitals that we have not seen to this point of the pandemic. If we are among the 38.6% of British Columbians who have had our first shot, or if we'll soon get our first shot, and as good as we should feel about either, I would hope that these 2 surgery reports would help keep us focused, all of us, on those who care for us in our hospitals, those in hospital who need care, and those in need of surgery who have seen COVID-19 delay the surgery they had scheduled. Each of them, whether care provider, someone in need of care, or someone awaiting surgery, is counting on us to do all we can to stop the spread so that we can push back the COVID pressure on our healthcare system. And that means for all of us, keep using our COVID skills, that we keep following public health guidance, that we continue to adhere to public health orders, that we register for our vaccination, and that we ensure that when we travel, it's for essential reasons only until the end of the May-long weekend. That's how we push back the COVID pressure on our healthcare system. That's how we keep safe. And that's how we keep making the difference that matters to those who are counting on us. Aujourd'hui, nous annonçons 787 nouveaux cas qui ont testé positifs au COVID-19 pour un total de 128 676 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 pour un total de 1577 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie